So I'm just going to give a brief update on a couple key issues, and then I really want to leave time for questions. So I can stand up here all day and talk about the tremendous gains under the Affordable Care Act, but I really want to focus on the three key buckets of work moving forward. So the Affordable Care Act set up health insurance exchanges. This will be a place where people will be able to go shop for health insurance coverage. They'll be able to compare plans easily. I know a lot of you guys here are small business owners. It'll be great for small business owners. Your employees will be able to go into the exchange. You'll be able to shop, compare apples to apples. There'll be levels of plans. It'll make it a lot simpler. But on top of that, people will be able to get subsidies up to 400% of poverty. So what does that mean? If you're an individual that makes up to $42,000 a year, you will get help buying health insurance coverage through this health insurance marketplace. So the idea is really to make affordable coverage for everyone, and also make sure that there's quality plans, that it's easy to choose from, and it will be regulated. The Affordable Care Act left it up to the states to decide what they want to do. If they want to run a state-based exchange, or if they don't want to, HHS will come in and run an exchange for us. At this time, Governor Corbett said, we're not doing it, we have too many questions. So it looks like the federal government will come in and run an exchange. But that's not the end of the world. It means that people will still have health insurance coverage January 1st, 2014. People will get the subsidies. And if Pennsylvania decides later that they want to go forward and operate their own exchange, we can. I just want to emphasize this again because we're seeing this come out more in the media, especially in the past couple days. Simply because Pennsylvania does not go forward with running it itself does not mean that we won't have it. We will have an exchange. People will be able to get coverage. Small business owners will be able to get coverage through the health insurance marketplace. I think the other big issue that we're out talking about, which is kind of the elephant in the room, is the Supreme Court upheld every piece of the Affordable Care Act. It's all constitutional. It's all here to stay. But one of the things they did was they said the Medicaid expansion piece is optional for states. Medicaid expansion under the Affordable Care Act would expand Medicaid up to 138% of poverty. So that's about $15,000 for an individual, about $31,000 for a family of 4. It also gets rid of a lot of the categories. So right now, if you guys are familiar with the current Medicaid system, you have to be disabled, you have to have children. It's very hard to get Medicaid coverage if you are a single working adult that's healthy. The Affordable Care Act gets rid of the categories. It's just income. So if you make up to $15,000 as an individual, you will qualify for the expanded Medicaid program. But this is the big issue that is before us. Because the Affordable Care Act said that this piece was optional, Governor Corbett has the power to decide whether or not he decides to take the Medicaid expansion. It's fully paid for the first 2 years by the federal government. It's reimbursed at 100% matching rate, 90% years after. It'll bring about $17 billion into our state. That'll create healthcare jobs, along with giving 500,000 Pennsylvanians the opportunity to get healthcare coverage. And these are people that are going to be left out of the system otherwise. So we are currently working to urge Governor Corbett to accept this Medicaid opportunity. He's been really quiet on the issue. We have a bunch of stakeholders that meet regularly. And we made a calculated decision not to push him too hard before the election. Because one thing Governor Corbett does is if he's backed into a wall and he says no, we can never change his mind. Well, now the election's over, so the gloves are off, and we're going to push him to take this program. So if you guys know people that fall into this category, we're looking for people to share stories about what it would mean if they could get health care coverage under this, or if they are left out. So those are the two big pieces that we're focused on the state level. And we're going to continue to watch the implementation process, as well as educate people about the benefits of the new law, because there's just so many benefits. We want people to take advantage of them. For small business owners, if you have 25 or fewer employees and your average wages are $50,000 or fewer, and you offer health care coverage to your employees, you pay 50% of the cost or more, you're eligible for tax credits. It's 35% now, and that goes up to 50% in 2014. This extends to nonprofits as well. It's pretty significant. We all know healthcare costs are going up and up, and this is one way to help small business owners until the full law goes into effect in 2014. I will take whatever questions you guys have. Yep.
Just for the small businesses, have you heard anything about those who have made the application to get insurance and they have been told that it's a certain window and wait to the first of the year?
A lot of times insurance companies have open enrollment periods for small business. You can't get the tax credit until you're actually paying. In 2014, it's up to 50%.
35%.
It's 35% now, and it's based on a sliding scale. So if it's 50,000 is the high end, but if your workers make $25,000 and you have 2 employees, you'll get the higher end of that tax credit. Or if you're at the 50,000 and 25, you won't get as much.
Just a follow-up question, what happens to those that are falling outside of the 400% poverty rate and the 130 for the expanded Medicaid Act? What is happening to those? For example, most of the owners that I'm talking to fall outside of that poverty.
Above the 400%. There's a whole bunch of private health insurance reforms that have helped people with private health insurance. So they can't charge you more if you have female employees. That's a huge issue. You can no longer have lifetime or annual limits. So lifetime limits, you think you have a really good policy, private health insurance plan. You come down with an illness, maybe multiple sclerosis. You blow through your $1 million limit in a couple of years and then you're left uninsurable. That practice has been ended for people with private insurance. Annual limits will be phased out by 2014. Young adults can now stay on their parents' plan if you have private insurance up to the age of 26. And just to answer your question, if you make over 400% in poverty, you'll still be able to shop in health insurance exchange. If you currently don't have insurance in the first couple of years, that's when you'll be able to shop in the exchange. The idea is competition and all of the new people in the market will help drive down the cost for everyone. So you're not barred from the exchange if you don't fit into that income category.
Small businesses being able to shop and to exchange and pick a plan that works for them. In your head, that would be a percentage of their income, and they would be charged for insurance, or is it cap on it or something like that?
So how exactly it's set up, we're not sure. But for example, we talk about the penalty. If you're a small business with 50 or fewer employees, you will not face an employer penalty. There are protections for employees. So if your employees qualify for subsidies in the exchange, but it costs them more than 9.8% of their income, your employer would face a penalty. Or if you as an employer would face a penalty if their health insurance is not affordable. That makes sense?
Because
It's just something that's alarming.
So starting in 2014, everyone will be required to purchase health insurance or face a penalty. Employers with 50 or more employees will face a penalty if they do not offer their employees health insurance. If those employees fall between up to 400% of poverty, because what we're saying is, why should the government pay for your employees to get subsidized health care coverage in the exchange? So that's where the penalty comes from. And how you want to do it as an employer with the subsidies and your people going into the exchange, that will still be left up to you. You just have to know that the health insurance plan that you pick can't really cost more than 9.8% of your employees' income. But again, that's for 50 or more employees.
how do they define employers? Because some have multiple sites, so that would be one employer, right?
Oh, would they count it like that if it's for multi-sites?
The IRS is still issuing guidelines on that. I can double check. I don't know if they've come out yet. But part-time employees that equal full-time employees, seasonal employees are exempt from the count. There's just a lot of different, and if people work under 30 hours, the part-time employee, we have 4 part-time employees that equal full-time wages. It just gets pretty complicated. I know it's a lot of information and it's kind of a scary thought, but from our perspective, it's really going to help small business owners be able to afford coverage. If you've ever had to shop for health insurance coverage as a small business owner, and you have an employee that has an illness or is even a female, you get charged astronomical rates. And the health insurance exchanges and all the protections that get put into place, that will stop that process in 2014.
In the last year, like the House of Representatives kept passing some bill to, stop the Affordable Care Act. Okay. So is there any chance that they can actually stop it?
At this point, with the Senate the way it is and with President Obama in the White House, it would be very difficult. What we should worry about is in some of these debates, we've seen, money here and there rolled back a little bit. There was a bunch of money for health centers. We saw a little bit of that go away through bills passed in the House. One of the things that we're worried about in the fiscal cliff and the new budget negotiations are cuts to Medicaid, and along with that, money that will go to reimbursing states for the new Medicaid population. Governor Corbett and a bunch of other governors are undecided, so if we see any cuts to Medicaid come out of this debate, it'll cause governors like Governor Corbett to say, see, look, I told you the money's not going to be there. So there's little pieces like that we have to watch, but I think we're in pretty good shape.
And I had a question about Medicaid expansion and them not being covered under the exchange. Is that because of the way it's defined?
Right, so the way the law was written, it assumed that people would get coverage through the exchange or through the Medicaid expansion. They never thought that there would be an option for the Medicaid expansion. The exchange starts at 100% of poverty. The Medicaid expansion starts at 138% of poverty. So there is this group that could get subsidies in the exchange. But the way the law was written was that those subsidies aren't going to be enough to make coverage affordable for that group. No one thought when they wrote the law that that group would get the subsidies. They just thought they would go into the Medicaid expansion. So it's really scary to think that there's this whole population that will be left out of the marketplace.
Just because the subsidy wouldn't be enough
No,
for them?
I mean, it would be very hard, and I don't have the numbers off the top of my head, but I don't think it would be enough to make coverage affordable for that,
100% of poverty who aren't currently eligible for Medicaid.
There will be, if we do not opt to do the Medicaid expansion, that group will continue to be uninsured. If we do not expand Medicaid, there will be a population, and it's the same population now, that will be left out in the dark. And it's really working individuals. I mean, it's child care providers, it's hairdressers, working Pennsylvanians that will be continued to be left out because any sort of income without a disability or an illness or a child really disqualifies you under the current Medicaid system. And I think in our state we have a huge coalition working together. We also do a Tuesday night call series where we talk about these issues. This Tuesday we're going to talk about the federal budget along with what does the election mean for healthcare in the state.
What's the time frame for all these decisions?
So currently there's no deadline. States can opt in whenever they want to. And interestingly enough, this morning I got a call from a WHYY reporter who had talked to Corbett's office, and Corbett is saying, well, there's no rush, we can do this whenever we want. But the issue is if January 1st, 2014, people are getting subsidies in the exchange, the hospitals don't get their dish money, there's going to be this population that goes to enroll and they won't have health insurance. So it's really critical that we make this decision in the next several months so that we can put all the pieces together.
So what can we do as a group to help move things along?
We are drafting a sign-on letter that's going to go to Governor Corbett. It's going to come out later today. The more people that sign on that letter, the better, that urges him to move forward with the expansion. It's worth making calls to your legislators. It is Corbett's decision, but pressure from the legislature helps. And it's still a little unclear if it has to go through the budget process or not. We're looking for stories of people that fall into this gap, who don't have health insurance that would get coverage. Because one of the things that moves public opinion the most are hearing personal stories about the person that doesn't have health insurance who will have health insurance under the new law. So if you know people, let us know, and that would be helpful. And we are just starting to gear up, so we'll be doing a bunch of actions and lobby days and events around this, and as we get ready for that, we'll make sure you guys have the information. Thank you.
Thank you.